Good afternoon. My name is Stephanie Mina, and today I will be presenting vitamin D deficiency and autoimmune thyroid disease, my IRB proposal presentation for APN 615. Vitamin D is often referred to as the sunshine vitamin. It is a fat-soluble vitamin that is associated with bone growth, strength, and development. It aids in the homeostasis of serum calcium. Vitamin D also plays a role in cell differentiation, cell proliferation, and growth. Deficiency in vitamin D results in rickets in young children and osteomalacia in older children and adults. Rickets can cause bone deformities, bone and muscle pain, increased risk of fractures, whereas osteomalacia causes bone and muscle pain, increased risk of fractures as well. It's associated by the bone failing to mineralize due to a lack of vitamin D in the blood, which also causes a lack of calcium. So essentially, the bones become soft. Toxicity with vitamin D results in hypercalciuria and hyperphosphatemia. This causes damage to blood vessels, soft tissues, and organs. Essentially, they start to calcify and become hardened, making them fail to function correctly. Vitamin D has two main forms, D2 and D3. D2 is the form of vitamin D that is often found in food sources, such as fatty fish, eggs, mushrooms, fortified foods like milk. D3 is made subcutaneously from exposure to sunlight. Both forms of vitamin D can be supplemented in pill form. However, D3 has been found to be a little bit more effective for supplementation purposes. Vitamin D deficiency has quite a few symptoms: increased rate of illness, fatigue, bone and back pain, depression, slowed wound healing, bone loss, hair loss, muscle pain. So nothing that anybody wants to ever have to deal with, especially altogether. Some other roles of vitamin D: it has a significant role in immune function. Most immune cells contain receptors for vitamin D, which allows the cells to convert vitamin D from its inactive form to its active form so that it can be utilized in cellular function. Recent research has also suggested that vitamin D may play a role in the development and protection from cardiovascular disease, metabolic syndrome, cancer, infections, and autoimmune disorders. We will be focusing on autoimmune disorders today. So different types of autoimmune disorders that can exist: we have rheumatoid arthritis, lupus, celiac disease, multiple sclerosis, cystic fibrosis, diabetes, and autoimmune thyroid diseases. There's quite a few more. However, we will be focusing on autoimmune thyroid diseases today. So autoimmune thyroid disease is estimated to occur in about 5% of the general population, or at least that's the amount that has been diagnosed. It is believed that there's probably a much higher percentage due to inaccurate or undiagnosed occurrences of the disease. There are two main types of autoimmune thyroid disease: Hashimoto's thyroiditis and Graves' disease. Hashimoto's thyroiditis occurs when the body produces antibodies which attack the thyroid, which cause it to stop functioning. And Graves' disease is the opposite, still with antibodies that are attacking the thyroid, but this causes the thyroid to overfunction. Symptoms of the disease include irritability, weight gain or weight loss, depending on which form of the disease that you may have, inability to regulate your body temperature, and a number of other associated symptoms. Low vitamin D levels have been associated with both disease states. So looking at some of the literature from recent years, a number of studies have shown that vitamin D deficiency has been found with patients with autoimmune thyroid disease in comparison to healthy controls. So more of them have a vitamin D deficiency in comparison to their healthy counterparts. It has also been shown that significantly lower levels were found in patients with Hashimoto's thyroiditis compared to Graves' disease. However, both do have significantly lower vitamin D levels. A study by Busker et al. Showed that the severity of vitamin D deficiency actually positively correlated with the duration of Hashimoto's thyroiditis. So the longer somebody had been diagnosed with thyroid disease, the more likely they were to have significantly lower levels of vitamin D. And this was actually more significant in females than it was in male patients. Unell et al. Studied the relationship between the presence of thyroid autoantibodies and vitamin D status. They actually found that vitamin D deficiency was more likely in patients with Graves' disease in comparison to Hashimoto's thyroiditis. However, both were significantly more likely to have low vitamin D status in comparison to healthy controls. There was also a negative correlation between vitamin D levels and the presence of thyroid antibodies, which suggests that vitamin D may actually play a role in the development of autoimmune thyroid disease. Some more studies. So one looked at the relationship between low levels of vitamin D and autoimmune thyroid disease in elderly patients, showing that patients with normal levels of vitamin D were actually less likely to develop an autoimmune thyroid disease. In children, vitamin D deficiency was significantly more common in children with Hashimoto's thyroiditis than in an age-matched control group. I'm not going to try and say the name for this next one, but it was 2.28 times more likely for patients with Hashimoto's thyroiditis to have vitamin D levels below 20 nanograms per milliliter. So for diabetic patients, patients with a vitamin D deficiency were at higher risk to develop an autoimmune thyroid disease, as well as an increased risk for the development of thyroid cancer. So a lot of research showing that vitamin D is associated with autoimmune thyroid disease. Some other studies also showed that there was no significant difference in vitamin D levels between patients with autoimmune thyroid disease and healthy controls. And one showed that looked at patients with a genetic predisposition for the development of an autoimmune thyroid disease and the number of individuals that did go on to develop an autoimmune thyroid disease. Neither showed significantly low levels of vitamin D for those studies. Another study showed that vitamin D was more likely to be sufficient for patients with Hashimoto's thyroiditis, and that was actually more likely for males to be deficient than females. That one represents an anomaly in the current literature because almost all of the studies that I've looked at and that exist show that vitamin D deficiency is more common with an autoimmune thyroid disease, and it's actually more common for females than it is for males. And Araki looked at the effect of vitamin D supplementation in patients with Hashimoto's thyroiditis, and it showed that vitamin D supplementation had no significant effect on thyroid function and autoimmunity. So there's been a lot of research conducted looking at vitamin D and autoimmune thyroid diseases. However, the results have been pretty inconsistent, and none have been able to come up with any conclusion of what role vitamin D may play in the development and symptoms of autoimmune thyroid disease. So for our study here, our goal is to try to determine if vitamin D supplementation can decrease biomarker levels in patients with autoimmune thyroid disease, as well as to alleviate some of the symptoms of autoimmune thyroid disease. And it's also to examine the role that vitamin D deficiency plays in the pathogenesis or the development of an autoimmune thyroid disease. So is it a precursor to the development of the disease? So our research questions: does vitamin D supplementation improve symptoms and biomarker levels in patients with autoimmune thyroid disease? And do patients with an autoimmune thyroid disease have a history of vitamin D deficiency, indicating the possibility that vitamin D plays a role in the development of an autoimmune thyroid disease? So the population for this study will be males and females between the ages of 25 and 40 that have a dual diagnosis of autoimmune thyroid disease and vitamin D deficiency. Any participants must not have any comorbid diagnoses such as cystic fibrosis, fat malabsorption disorder, celiac disease, or other autoimmune disorders. That's just to help control any confounding variables. And their vitamin D serum levels must be below 25 nanomoles per milliliter. They will be recruited with the assistance of physicians working with the American Thyroid Association, and all testing will be completed at university satellite locations across the country to make sure that we have a varied population. The study design, so initial or baseline fasting blood work will be completed, looking at vitamin D, TT3, TSH, anti-thyroglobulin antibodies, thyroxine, and anti-thyroperoxidase antibody. Specifically, just those are the biomarkers that help to determine thyroid function. Each patient will also fill out a questionnaire to determine the specific symptoms that they may be experiencing due to their autoimmune thyroid disease. So fatigue, their ability to focus, irritability, regulation of body temperature, those types of questions. So after the initial blood work, we will go into the supplementation phase. So an initial loading dose of 50,000 IU 3 times per week for 1 month. It is a protocol, however, it is not clinically tested. So as a safety precaution, each participant will be closely monitored for toxicity. Blood tests will be completed twice during that first month, specifically looking at parathyroid hormone levels, serum calcium, and vitamin D serum levels, and any patients exhibiting signs or are close to toxicity will be immediately removed from the study for safety reasons. After the initial loading dose, each patient will receive a daily dose of 800 IU per day. I went with a lower dose simply because of such a high dose at initial supplementation. There will be follow-up blood work completed after 3 months and 6 months, again, fasting, looking at the same biomarkers that were looked at in the initial baseline blood work, and follow-up questionnaires asking the same questions to look at any improvement in previously reported symptoms. During our consent process, each patient or each participant will be requested, or permission will be requested from them to look at blood work results for up to 5 years prior to their diagnosis with an autoimmune thyroid disease. Specifically, we'll be looking at vitamin D deficiency or insufficiency prior to their diagnosis. So all information will be gathered will be accessible only to the members of the research team. Blood work results will be kept in an offline, password-protected computer in a locked office, accessible only to the research team. And once results have been analyzed, all records will be destroyed. Safety measures have been put into place to carefully monitor each participant for negative side effects of the treatment protocol. Those were discussed previously, and all lab work and supplementation will be of no cost to each patient. Data analysis will be utilized to support or reject the hypothesis. So we'll use a repeated measures ANOVA to compare the baseline 3-month and 6-month blood work results and test for significant improvements in biomarker levels and vitamin D serum levels. A repeated measures ANOVA will also be conducted to compare the initial questionnaire responses from baseline to 3 months and 6-month responses. Differential statistics will be utilized to determine if there is any significant occurrence of vitamin D deficiencies in patients prior to their diagnosis with an autoimmune thyroid disease. So we'll be looking at the mean, median, those types of things. So there are some risks for this study. As I mentioned before, vitamin D toxicity. Each patient will be monitored carefully to ensure that there are no signs of toxicity, and if they begin to show any signs of that, they will be immediately removed from the study. And there, of course, because there is blood work being done, is a minor risk of injury or infection due to the blood draw. The benefits, though, greatly outweigh the risks for this study. It could develop into improved treatment protocols for patients, as well as a better understanding of the environmental factors that go into the development of autoimmune thyroid disease. Treatment for existing vitamin D deficiency as well as autoimmune thyroid disease is a plus for all of these patients because they do have those diseases and deficiencies. So study contributions, it will significantly contribute to the scientific and medical community because it will allow us to understand the role that vitamin D deficiency may play in an autoimmune disease. It will improve the quality of life for patients with a comorbid diagnosis because they'll be receiving treatment for both of those. And there is a possibility that it could be generalized or develop into an improved treatment protocol for patients with other autoimmune diseases. If it works for an autoimmune thyroid disease, it may work for an autoimmune disorder such as lupus or rheumatoid arthritis to help improve symptomology for those patients, or the protocol could be repeated to see how it works for them. So that is the conclusion of my study. Thank you and have a great day.